Hi, this is Dr. Jansen, and I'm very interested in talking to you about peripheral neuropathy. That means pain or burning sensation in your legs and feet. It could be a numbness in your feet too. You just feel like you're walking on cotton, patients tell me. Now you should know the underlying reason for having peripheral neuropathy. It's very important. So if you do have these symptoms, please go to your doctor. And they're going to do a very simple tests on you, blood tests, and send you for an MRI. You might need a nerve conduction velocity test with the neurologist, so you'll get sent for that test. You know, so they'll figure out why you have neuropathy. It's very important. You could have a herniated disc or a problem with your back. You have no back pain at all, but you can have a pinched nerve that's causing a lack of sensation in your leg, or pain shooting down your leg too, kind of neuropathy. And that can show up just in the middle of your calf muscle, just this shooting, burning pain, you know, and that's actually from your back, from a herniated disc. And the disc will be a little swollen, you don't feel it. Other reasons for neuropathy are immune problems, diabetes, of course, everyone knows that, I think. So there's many causes of neuropathy, so make sure you know what is the reason for your neuropathy. And the number one way to treat neuropathy is to control the underlying condition. So that's why you have to know your diagnosis. So in other words, if you're a diabetic, you need to get your sugar numbers under control, you know, really control your diet, for example. And other treatments that you might receive are prescription medication like anti-seizure medicines. That sounds very strange, but they actually do help neuropathy. Gabapentin, Neurontin, and pregabapentin, which is called Lyrica. Those are medicines that can really help with neuropathy. So you may need a prescription for those medicines. In my experience, I think it's a very bad idea to use opiate medications, painkillers for neuropathy. They're very addictive, and when those painkillers wear off, the neuropathy is 10 times worse. So you become very dependent on those medicines. And they make you very loopy and difficult to focus, and you know, it's hard to get things done during the day on those medications. So I don't recommend opiate, you know, narcotic painkillers for neuropathy. The other medicines, the anti-seizure medicines, are much better. Another medicine they use is actually antidepressants. Antidepressants work on chronic pain because they interrupt the chemical process of pain in your brain. So your brain gets confused and says, you know, do I have pain? Or maybe I don't. So the antidepressants work that way, even if you're not depressed at all, but they may give you an antidepressant, and that can work really well. Over-the-counter medications are NSAIDs. And sometimes the doctor will give you a prescription NSAID, like meloxicam, for example. That's a good NSAID, non-steroidal anti-inflammatory drug. An over-the-counter one is ibuprofen. That can actually really work. And then what else can you do for yourself at home? That's really what I was interested in talking to you about. I have so many patients with neuropathy, you know, and they really suffer from this. So I'm giving them this advice all the time. So it's a lot easier for me to make a video, have them watch this video, and then, you know, they can hear all the instructions that I like to give. So number one, make sure you use a good moisturizer on your legs. Because for some reason, if your skin is even slightly dry, it will exacerbate or trigger the shooting pain or the burning that occurs in your legs and feet. So please use a very good moisturizer like Eucerin or cocoa butter or some kind of moisturizer like that. I actually have in the office here, we have a moisturizer that has painkiller in it. Sort of menthol product with cocoa butter, and we like to give that to the patients with neuropathy, and they put it on especially just before they go to bed, you know, so try to get a good night's sleep. So please use moisturizer. And then exercise. Make sure you go outside, walk every day for at least 20 or 30 minutes, because increasing blood flow also promotes healthy nerves for them to get good blood flow. So go outside and walk. Walking is the best way to pump the blood through your legs and feet. So you need to walk. You can also use a light compression sock, like what they call airplane sock. It's not tight, it's easy to put it on. You can get it in any drugstore, and it usually has a little airplane insignia on it. And what that does, and put it on in the morning, you know, and then you can go outside and start walking. And what it does is it helps the blood that's in the veins get pushed out of your feet and legs. So it increases the flow of blood. So, oh, there's the sirens again. Every video has the sirens. So, compression socks. You can elevate your feet too, that might help. Of course, good shoes help, good supportive shoes. So if your feet are in the right position, the muscles work more efficiently. And efficiently working muscles have better blood flow. So that's good supportive shoes, good shock absorbing shoes. Neuropathy in the feet, they're not mutually exclusive. You know, I'll see an immunocompromised patient that has a bad back. You know, that can happen. So one thing about neuropathy is you want to wear shock absorbing shoes. So don't wear thin-soled leather shoes, leather-soled shoes, because that can really irritate your back. So wear good shock absorbing shoes. So I think, and diet, you know, don't eat sugar. Get sugar out of your diet. And I hate to tell you this, here's the really bad news, and I'm leaving it to the last minute of this video. You know, really, don't drink alcohol, because alcohol, you know, if you keep drinking alcohol, it causes delirium tremens. You probably have heard of that. That's a, you know, that's a real neuropathy problem. Alcohol is very detrimental to the nerves, so try to drink as little or no alcohol, and try to decrease sugar. Sugar is very inflammatory. Grains, you know, have omega-6 and a lot of sugar, so try to get grains. Limit grains, sugar, and alcohol in your diet. So, okay, I hope this was helpful to you, and good luck with it. I know it's a very difficult problem, and you really have my sympathies, because it's hard to treat it. And it interferes with sleep. It can really be a problem in your life. So good luck with it, and feel free to contact me if you have any questions. Thanks.